Life is about shedding the darkness and embracing the light of knowledge. So let's get together and awaken our minds. Friends, welcome. Hello. My name is Dr. Akash Ahuja, and I'm a psychiatrist here in Los Angeles, California. I did my medical school from Maulana Azad Medical College in New Delhi, India, and I did my residency in psychiatry from Hennepin Regents program in Minneapolis, in Minnesota, United States. Welcome to the series of Awakening the Mind videos, and today we will be addressing the mental health issues in half the people. By half the people, I mean better half of the people actually. We are talking about women. Women who are our mother's spouse, daughter, friends, teachers, neighbors, and there are certain kind of mental health issues which affect women only. So we'll be addressing some of them. I'll be referring to some of the slides which I have made, and so again, let's talk about the issues affecting the women. We'll start with pregnancy. Well, how is pregnancy a mental health issue? It shouldn't be, right? Pregnancy is such a wonderful feeling. It brings so much happiness to the whole family, to the society, community, to the couple, anticipation of a new child, so many new dreams people take that this will happen and that will happen. So how is that linked to mental health, right? Well, people sometimes don't realize that actually 20% or more of women have some kind of mood issues or anxiety issues, and severe ones, when they are pregnant. And actually that is because of hormonal changes which people face, because there are lots of hormones are shifting in the body of a pregnant woman. I mean, talking about estrogen and progesterone and other hormones. The other changes which happen to them is physical changes. Their whole body changes. It's not only that the baby is growing in the uterus and you can see a bulging belly, but there are so many other changes going on in the women's body. And if she's pregnant for the first time, even though you can read about them, it's very different when you really see them happening to your body. And they can get more tired. They can experience more physical symptoms. They can have swelling in their legs. They have to keep the doctor's appointment. It might affect a little bit of their functioning at work, their relationship with the boss, their relationship with their family, the husband. Even though they all are happy that she's pregnant, might change a little, which can add to the stress. It can also be they also experience a lot of dietary changes. They have to keep in mind that sometimes they like different kind of foods which they didn't like before. So it's like so many changes going on. And the women who have some history of depression and anxiety to begin with, they are actually at even a higher risk of becoming more depressed and anxious during the pregnancy. Some women face this dilemma that they are taking medications, and when they become pregnant, then they stop taking the medications. I would not advise them to do that by their own. They should definitely meet their doctor, psychiatrist to discuss that. There are different classes of medications based upon what their effect can be on the child who is growing in the uterus, classified as A, B, C, D, and X. And it would be nice to discuss with the doctor to switch the medication or continue or stop it after knowing what they believe in. Again, pregnancy is very important aspect of everybody's life, not only the women's but the fathers also, and one should take care of these mood issues to really enjoy that time. I'd also like to add a little bit of point on breastfeeding here, that people who are depressed and anxious and are taking medications, though the medications will definitely pass through the breast milk to the child, they should not stop taking their medications because of that reason, because no study has shown that those medications which are okay in pregnancy will now not be okay while they are breastfeeding their child. And also breastfeeding is very important because it increases the bondage between the child and the mother, and also makes the baby healthy, which we all want to see, don't we? Friends, let's talk about the postpartum um, situation in women. By postpartum, I meant when a mother has already given birth to a child. What can happen then? Again, there are three things which can happen, and number one would be postpartum blues. And as the name mentioned, the mother's mood becomes a little blue. It means that that they can become very tearful, they can get a little upset, and it usually lasts for like maybe from fourth day or third day of pregnancy to not more than 2 weeks after the pregnancy is over, after the birth to a child is given. And that's actually considered very normal, even though it doesn't happen in everybody. It's normal if it ends after 2 weeks of giving birth to a child. The problem exists, and the problem occurs when it doesn't end at 2 weeks, and it leads to more severe symptoms of not being able to sleep well, feeling hopeless, feeling helpless, sometimes feeling suicidal. And all those things are basically the signs and symptoms of postpartum depression, which definitely should be treated with the help of psychotherapy or other antidepressant medications, which I have discussed in some other videos. The third one and the most severe one is actually known as postpartum psychosis. Now, postpartum psychosis actually occurs only in 1 or 2 out of 1,000 people. But if that 1 or 2 is the person who is connected to you, then it becomes extremely significant. In this, at times the ladies they get lost, they get confused, they lose the touch with the reality. They might develop strong feelings of animosity towards the child who is just born. They might in fact start hearing voices which are not real, and they might develop thoughts about hurting the child. Sounds very bad, but that actually is true in many cases. So this is like a medical emergency, and these people should immediately be taken to a hospital and to see the doctor to take care of them. Let's discuss something now which is totally opposite, which we discussed right now, pregnancy, and we discussed postpartum, and now let's discuss a condition which is actually inability to become pregnant. Yeah, we are discussing infertility. So infertility is the term which is used when women is not able to bear the children, and let's be honest, it can be it can have hundreds of reasons that somebody is not getting pregnant, but somehow the society still blames the women about that. Can you imagine a person cannot start the family, they have to live with this pressure, and yet people blame them that it's not happening. Also, these women can face a lot of stress and anxiety. They can feel angry that why is it not happening. They can face marital problems. Their relationship with their spouses can become a little topsy-turvy. Their place in the society gets affected. Their place at the work where they do can also be affected in an adverse fashion. Now, some studies have shown that depression and anxiety actually to begin with can cause infertility. It's not substantiated yet, but the theory behind that is that people who have depression and anxiety, they have some stress hormones in their body which prevent them from getting pregnant. Again, not sure, just a theory. Treatment of infertility sounds very easy, but when people go through them, especially the IVFs, it's not a very easy thing to do. And having the thought that what will happen if the treatment doesn't go very well, it's pretty scary. And again, a lot of stress and anxiety is on a woman to supposedly call successful in that particular treatment. So what basically we should do for infertility leading to psychiatric problems? Well, the first and the foremost important thing is the spousal support. It really depends upon the husband and the partner to support their wife and the partner to do well, to make them realize that they are not alone in that in that situation. Cognitive behavior therapy and various antidepressants, which again we'll be discussing in so many other videos, are also an option if people get clinically depressed. Infertility is hard, it's very difficult, but let's not make it more complex by starting to blame the female. Let's now discuss something which happens in which happens in 5 to 7% of the women population every year, and that is when they reach menopause. So as we all know, menopause is a situation where the women basically gets changed from reproductive age to being non-reproductive, and actually this is not like so cut and dry that one day you are okay and the next day you hit menopause. These symptoms, or this whole thing leading to irregularity of periods and all that, can last from 5 to 7 years, and a lot of hormone changes and physical changes happen to women during that time, and which is known as perimenopausal phase, and which can cause stress and anxiety in many people. One of the biggest reasons of the stresses is also physical reasons, which are women can experience hot flushes, they sweat at night, and due to the sweating they are not able to get a decent sleep. Because of that, they wake up pretty much tired in the morning, and that can lead to further anxiety and sadness. They experience palpitations, and their heart beats very fast, and it's just that they lose the natural ability of being themselves, and sometimes it's a very big stress to them that now I will not be able to get pregnant. So what to do when people show symptoms of depression or anxiety and they are hitting menopause? Well, again, people can go for cognitive behavior therapy by seeing a good therapist. They can be treated by antidepressant medications, and they can go to their gynecologists and obstetricians to get something known as hormonal replacement therapy, which can also, for short duration, help them with their physical symptoms as well as with depression. So friends, we talked about many important psychiatric issues which affect only the women, but actually that's not true. When it affects the women, it also affects men and the whole community. So let's at least discuss them, let's at least acknowledge that these things do exist, and then we can certainly work towards the treatment and making sure that that these things are taken care of. Thank you for watching this video.